Today, when you look at our incubator technology, in some ways it hasn't appeared to have advanced remarkably since the 50s and 60s. You have to have a more acute knowledge of thermoregulation to see all the really amazing technological advances that have occurred. But it's still often a box that warms the baby, and that was the technology that's been in existence to some degrees for 150 years. And because of this length of time and seeming expertise, we've sort of been lulled to sleep a little bit. And so the purpose of this really is to talk about what this is, how we're doing it, and maybe reinvent this wheel to some degree, to talk about this as a technology that still is very important and in some ways needs to be front of your mind rather than on the back burner when you're caring for these babies. So as an introduction, I'm going to talk about a baby girl, Elle, that was in our nursery at Thomas Jefferson University. But it's very typical, and a baby that probably is in everybody's nursery right now, and that is somewhere around 26-week preterm infant. So any baby less than 30 weeks, say, who's doing relatively well. This baby in this picture is a day life 2. Has moderate respiratory distress, had failed CPAP, required surfactant, put on a ventilator, and we at Jefferson would transition within 12 hours to an incubator. So you see the baby in this incubator, the mom's hand there touching the baby. But if you look closely at the baby, there are some issues that from a thermoregulatory point of view we're concerned about. The skin is very thin. You see blood vessels close to the top of the skin. And the baby looks comfortable, but after all, the baby's sitting there sort of naked. It's the winter time. You're thinking, you could be thinking, wow, this is a little unusual. I don't usually run around the nursery naked, at least not very often. And this baby is in that environment where you're looking at a baby who is exceptionally warmed in a special environment. If you look further in this environment, you'll see a baby that is in a nest. So this baby is nested in a nice little comfy zone. That is also a critical portion of both thermoregulation and developmental care for this baby. And so that advance, for those of you who haven't been in the NICU for decades like I have been, is new. Before, in the 80s and 90s, we didn't have these nests, and the babies would often be falling off the sides of beds. So not on the floor, but into the cracks. And so that was an issue that we've really learned to deal with, and that has helped in many ways nurture these babies. So this is a typical infant. We're going to explore the issues of thermoregulation in reference to this infant and how we would routinely manage these situations. So when you talk about thermoregulation, you really talk about several environments, and you should know about each of these environments.